time out of your busy schedule to do this. And as you know, I'm teaching a class on cannabis and health and trying to talk to experts across the country. And the module we're doing right now is on sleep. And you've had funding now for a while from the state of Colorado to look at sleep and cannabis. So I thought you'd be a great person to talk to. So again, I really appreciate you taking a few minutes. So maybe you can just tell us a little bit about what you're working on the research side of sleep and cannabis.
Sure. Thank you, Ken. It is a pleasure to talk to you today. Our grant was funded by the CDPHE, as you know, and the primary aim was to look at sleep function with polysomnograms, which I'll discuss in just a minute, in 220 frequent cannabis users and controls. And our original hypothesis was centered around insomnia and testing whether or not frequent cannabis users and frequency of use was related to insomnia and sleep. But we've done other kind of extensive evaluation of other functions of sleep, including apneas. Our study is a basic observational study. As you know, it's difficult to do randomized controlled trials. That was our original intent, but because of the funding, we had to limit it just to an observational study. And basically, our study takes frequent cannabis users and non-cannabis users as controls, and we come in and evaluate their cannabis use through an extensive cannabis use questionnaire, and then draw some blood and hook them up to a polysomnogram, which I'll talk about in just a minute, and then basically watch their sleep, which they take home. Is wearing this device which records ECGs and cardiac telemetry, flow sensors around the nose, and as well as muscle movements. And then we bring them back in the morning and check their blood and check their urine to assess cannabinoid levels in their urine. We do 3 cannabinoids. And then we're basically testing to see the quality of sleep, and then whether that associates with the frequency of use, but self-reported frequency of use, or cannabinoid measurements in the blood and urine.
So, quick question for you: on the users, are these people who are using for sleep or just using in general?
That's a great question, and as you know, most people are actually using either recreationally or for pain, and then there's a good number of people who are using for anxiety. And we get a mix of both recreational and medical users in our study. And I probably should have started with kind of what's the rationale, why would you even bother studying cannabis and sleep? And there's actually prior evidence that looking at cannabinoids, and particularly dronabinol, and how it affects sleep, sleep initiation in particular, and you can otherwise frame that as late onset latency. So that means how long does it take you to fall asleep? And there are some suggestions with very small studies that the cannabinoids were effective in promoting that sleep onset, possibly even reducing apneas, which I'll talk about in a minute. And there was some animal work that backed this up, detecting cannabinoid type 1 receptors or CB1 receptors in the areas of the brain that control sleep, such as the forebrain and the base of the brain. So we have a lot of rationale for why cannabinoids might be important in the pathophysiology of sleep. But because this is an observational study, we really had to take what we could get in terms of people using cannabis, and it, I think, reflects somewhat the general use in Colorado, which is both mixed and recreational use. And if we have time, we can talk about really the complexity of doing these studies, because most people actually don't use cannabis in a single way. They use cannabis in multiple ways throughout the day. So either smoked or edibles or vaping. And so we've certainly, one challenge has been how do you quantitate these multiple uses, and then also bring in what type of product are they using? Are they using high potency THC, or are they using CBD based products? And that actually we found that's also varied in our population, which complicates the analysis, because there's so many factors that are determine what the dose is for people, and there's no easy one type of dose. We found that most people actually it's multiple doses during the day and night, and multiple types of cannabis, multiple potencies of cannabis.
Right. That definitely makes it difficult. I mean, all the factors you just alluded to, it makes it difficult. And I guess you have a chance, obviously, after you collect all the data, is to tease some of it apart, right? So you're obviously collecting the information, so you can go back and look at who's using for pain, who's using recreationally. And the information is really important, right? Because even people who are using recreationally, if it's actually causing sleep problems, then we need to know that, right? That becomes a risk. And then, of course, people who are using for pain and maybe it's having some benefit in sleep, it could be indirectly through alleviation of pain. But all these things are important, and all those factors you just talked about. And, I think when I talk about these issues in class, it's basically talking about them as a source of some of the contradictory findings out there, right? So there's, and that's kind of pervasive in cannabis research in general, is that we have contradictory findings. It's hard to make sense out of it. And all the reasons you just mentioned, those are the reasons why we have those findings, right? So.
Right. And so you pointed out some important points, and that is people who have chronic pain, which is a big, group of cannabis users, have disrupted sleep to begin with. So finding the right control group can be challenging, and same thing for anxiety, that can lead to disrupted sleep too. So adjusting for these factors will certainly be important in our analyses. And as you mentioned, in trying to evaluate the literature, which is not very extensive for sleep, one needs to take into account those factors, in particular the patient population that's being studied.
Do you have any preliminary findings yet, or you're still right in the middle of it?
No, we've enrolled. Our goal is 220 subjects, and we've just recently past 200. So we're nearing completion of data collection for the study. So we don't have any findings yet, but we do have some preliminary findings, and we, of course, based on analysis of the first half of the cohort. And the surprising thing, most surprising thing so far was that there's actually a correlation between apnea-hypopnea index and frequency of use, either measured by self-report or by the total amount of cannabinoids in the urine. So, the self-titrated dosing. Now that was a little surprising to us, because some prior literature had suggested that the cannabinoids might actually reduce the apnea-hypopnea indices, although some other literature on heavier users, particularly people in withdrawal, suggested that that's actually going to make sleep quality worse. And there wasn't really a lot with polysomniograms looking at chronic kind of high frequency users. So this may be a novel finding. It will be a large study, So we're looking forward to really analyzing our full data set later this year.
Right, right. So basically, what you're saying is the association was such that the heavier the use, the worse the apnea, basically.
Yes.
Yep. And this is actually fascinating because one of the things I'm talking about too in class is that there was the recent issue. I think it was Minnesota that basically listed apnea as a medical indication for cannabis, and there was some backlash in the medical journals from the medical community. I'm not sure if you're familiar with that.
A little bit, I am familiar, yeah. And I think one of the issues which we've discussed, and will be hard to assess, is whether or not there's probably a difference between acute short-term usage and long-term usage. And then there also may be a U-shaped curve, so smaller doses, particularly on a short term, may have more of a beneficial effect, whereas long-term chronic high frequency, high dose chronic usage may have kind of the opposite of the intended effect. And that could be due to downregulation of receptors, for instance. I'm not too sure our study will be able to answer this.
Obviously, there'll be studies that follow. I'm sure you'll do work that follows this up too, but it certainly will be
Yes.
helpful just to get a sense of where your data is coming in. And this issue of long-term use versus short-term use. And long-term use, you may see negative effects, right? And then, of course, the dose is important too. You mentioned that also. And then the final thing, which is really tough to look at, but the issue of CBD versus THC
Right.
can also be important too. And I'm not sure how that plays out with respect to apnea, but in terms of insomnia, that could be an important thing as well. So that it's fascinating, just getting into these details and trying to sort of understand what's going on. But everything you're saying is super consistent with my class, which I'm really glad to hear. So I'm not messing things up, which is good. But just quickly, your primary expertise also is in lung function, right? And we covered in a module previously, we covered some of the potential risks of cannabis. But I'm curious also about your work on lung function in cannabis.
Yeah, so we're actually doing lung function in this study too, and doing some unique things that haven't been done before. But I think lung were really what got me interested in the field of cannabis and the legalization in Colorado, because the primary use still of consumption of cannabis in Colorado is smoking. And smoking a plant product reminds me of smoking tobacco. So I really, before I did any reading on this, thought, smoking cannabis would have similar effects as smoking tobacco. And as I kind of dug into the literature, I found that it's actually not the case. So short-term studies in the 70s and 80s examined the short-term effects of smoking cannabis. This was rather low potency because it was done in the 70s, 80s. So you're talking about 2 or 3% THC. They found actually it improved lung function on the short term. So that's, one day it was essentially worked as a bronchodilator. But a lot of these studies were done in young people who were not heavy users. Subsequent kind of cohort epidemiologic studies evaluated the long-term effects of smoking cannabis, and they actually found that there was not an increased risk of obstructive lung disease, COPD, which we typically see with tobacco, nor I think that was there really increased risk of lung cancer, although that's certainly controversial too. However, there was no benefit really seen in terms of this bronchodilation that was seen in the short-term studies. The main negative effect, which is very consistent across studies, and we published to support this, is a chronic bronchitis phenotype. And that means kind of coughing and wheezing was in many, many studies, including studies that we published, has been higher, more commonly associated with chronic cannabis use than in non-users. But in terms of long-term chronic obstructive pulmonary disease, that has not been consistently shown. And then there's even a finding, which we've reported, as have others, of possibly larger lung volumes. And nobody quite understands why. The hypothesis is people who smoke cannabis maybe practice, frequently taking and holding deep breaths, and that may lead to larger lung volumes. We've observed that in several of our cohorts and published on this, but I think that the full explanation for that is unknown. So that's sort of my summary, and a lot of this is included in the CDPHE biannual report, which came out most recently last year.
Mm-hmm. Cool. Yeah. Well, we're kind of running out of time here. I have one last question for you. So, where do you see things going? I know. So, you're wrapping up your initial sleep study. Obviously, you're doing work in the area of lung function. Where do you see? What are the next important questions that you feel like you need to address?
Well, I think we need to do a follow-up on the apnea and the chronic frequent users, because that would be an important side effect or adverse effect that people should know about. And then ultimately, I think to evaluate benefit, either short-term or long-term, one needs to do randomized controlled trials. And we are investigating whether or not those should be done with CBD strains or more THC strains. There's been very little published on CBD. I don't know if we're going to have enough subjects who are taking primarily CBD to address those questions, but those are some of the unanswered questions we'd like to address in the future.
Makes sense. That's awesome. Well, I want to say thank you again. You're doing some fantastic work down there, and I definitely need to get down there more often and to touch base with you. And I really appreciate it.
Great. Thank you, Ken.
All right. You have a good day, Russ.